Hi, welcome to another communication and interpersonal skills for non-USIMG. My name is Julius Haryadi. I'm an internal medicine physician working here in US. I have almost like 8 years experience working in the US clinical settings. Today, I would like to share with you what I typically do during my patient encounter to help improve the patient satisfaction and experience. Now, if you're non-USIMG interested in learning more from me, I do have a clinical rotations in my office. You can use the link down description below. Put your name and email address and there will be an email sent to you, and it has contained a link, and the link will give you all the information that you need to know about the rotations. I basically help non-USIMG to improve their communication and interpersonal skills as we come from a different language and different culture, different background. I help you familiarize in US healthcare system in a more structured way and help you learn EMR as well. So again, if you're interested to learn from me, just use the link down in the description below. Now, having said that, let's jump into the video. So what I typically do day in, day out with my patients during my clinical encounter to help the patient satisfaction and experience. So the first step that I think is most important is the greetings. You have to greet them with a positive energy. So I knock the door 3 times, open the door. Hi, Beverly. Good morning. Dr. Haryadi, nice to meet you. How are you doing today? So give a nice smile. I typically always offer my hand to shake their hands. If the patient's not comfortable, and usually during the COVID pandemic a couple years ago, people will prefer to do a fist bump or an elbow bump. But I think nothing really replaces a good handshake. So I highly recommend you do a handshake. So wash your hands before handshakes, and after you're done, just wash your hands after you use a sanitizer or whatever. I think a handshake is very, very important. It creates that sudden connection and bond. Remember, the first couple seconds or first impression is very, very important. It's really set the tone for the entire encounter. So that's what I typically do. Another thing about the positive and energy tone is to have a good voice dynamic. This is something that I feel like quite lacking for a lot of non-USIMG who's just starting the rotations or doing a rotation in the US and probably starting to speak English, meaning that you want to have a nice range of voice. It becomes more alive, it becomes more interesting, it becomes more engaging if you use a good range of vocal dynamics. It's the way that I'm doing it right now. See, I'm going up and I'm going down. Some teacher or coaches like to say this is the Morgan Freeman techniques, because you're gonna go low and then you want to have some of the high notes and then go back down. That is what typically a lot of Americans do. This is kind of a little bit like an accent reduction as well. So accent, there is some target sounds that you have to target to make sure that you say it correctly, like saying book instead of book, or saying moon instead of moon. Those are target sounds. But another thing about the accent reduction is actually your dynamics. So you want to make sure you have this nice dynamics when you speak. Very, very important when you having conversation with the patient. Next thing is small talk. Yes, Americans love small talk. It's an icebreaker. You can talk about anything. And the small talk that I kind of enjoy, and which actually the best one, is the part where you are interested in what the patient, and then have them talk about themselves. That is always going to be the best one. I have learned that the best communications you have is not what you say, but what you hear. People love talking about themselves. If you can get the patients talk more about themselves, then that's gold. That's great. They will feel really good about themselves. They love being listened to. And another thing I want to mention is about active listening. Active listening is not only paying attention, like putting your head towards the patients and then fronting, right, or head tilt or maintaining eye contact. Not only that, that's part of it. Active listening means that you're able to respond to the patient's statement or questions. That means you are listening. The third thing, I would say this is the most important thing to improve that patient satisfaction and experience. It's a simple question that I always ask in the beginning of the patient encounter, which is there anything I can help you with today? So here is the idea of that question. That question really shifts that the encounter is all about the patient. So in the US, we always do a patient-centered care. The questions really shift the focus so the patient is the center and the patient is the spotlight. He or she is the one that we're taking care of. today. So a lot of times, especially in the primary care world, not so much in the hospital, I'm going to explain that a little bit here after this, but in the primary care world, we have a lot of agenda. We have to take care of that diabetes, we have to make sure that blood pressure is controlled, we have to make sure that the patient's up to date with colonoscopy, up to date with the vaccinations, up to date with that other cancer screening, probably patient need low dose CT scan, lung cancer screening, and then make sure the medications are correct and making sure that the doses are correct, the regimens are correct, this prescribing some of the meds. Some patients will need a stimulant or opiate agreement if they're taking some controlled substance, and there are so many agendas. It would be a mistake if we start with, have you done your colonoscopy? Let's see how your A1C is going. Let's see your high. No, that would be your agenda, not them. If you're doing that, what's going to happen is the patient's going to say, Doc, what about my shoulder? Patients come with a completely different agenda with yours in the primary care settings. It could be the same, but a lot of times it's kind of different. So that question is very important. Is there anything I can help you with today? And then the patient will have some list or things or questions that they want to ask, and it's very, very important to address those first. Not your agenda, but the patient's agenda, because patient-centered care, this is about the patients, not about you. I'm going to explain a little bit in the hospital. In the hospital, most of the time, the agenda for you and the patient is the same. Both of you want them to get out from the hospital. Patients want to go home. You want to get them out as well. The way to get them out from the hospital is to take care of the things that get them into the hospital. So for example, if the patient has cellulitis and that's why they come to the hospital, that would be your focus and their focus as well, so they can get out from the hospital. If the patients come in because of pneumonia, how to breathe, then that's their focus. They want to go home. They want to be taken care of, and that will be your focus as well. So in the hospital, usually your agenda and the patient agenda is pretty much the same, although in some occasions probably the patient would think like, I just need some water. So that becomes important. I just need to get some sleep. That could be the patient's agenda. So even in the hospital setting, remember that the patients have some needs as well that they think is important, and on top of what you think is important, and their needs has to come first, because we're doing a patient-centered care. Now we go back to the primary care settings. In the primary care settings, the agenda might be different. Now this is the practice that I do, that is, I would say, based on what I know, is a little bit different compared to the other people practicing as a primary care physicians. I would address all their concerns regardless of what the original purpose of the visit is. So for example, if the visit is an annual physical, I heard that a lot of provider will not going to address any issues or questions that come from the patient. They just come strictly for annual physical, so I'm just going to do annual physical. Everything else comes later. No, I don't engage on that kind of practice, because I do patient-centered care. What are their needs? And I need to take care of their needs. That's what I'm going to do for them. The rest is just a documentation and billing and then all these paperwork purposes. I will try to fulfill the criteria, whatever that is, to fit with that billing. But my primary purpose on that visit is to take care of the patient. So regardless of whether that annual wellness, whether that annual physical, whether they come in for the cough, and if they ask me about something else, I will address them. I will address them to their satisfactions. Okay, so that's what I usually do in my every patient encounter. Of course, if they have super high laundry list, I probably can try to cut them short by addressing it very quickly and jump and not go overly into a very, very great detail. Because for example, when you're starting, you will probably gonna ask the questions of the onset, duration, progression, the trigger, while making worse. If the patient have like 5 different concerns, then if doing all these detailed questions for all 5 would be time consuming, so you won't be able to do that. So you can try to focus on what, if there's anything that you want to get out from the visit today, what would that be? You can try to focus on one concern if there is really, really too many, and the patient will still feel appreciated and listened to. But I try to address it. Usually, based on just my experience, it's very, very rare for the patients to come in with like 10 laundry lists. I found that is very rare. If that happens, you're probably only gonna be late once for that particular one, and then particular day, maybe you're behind, you have a bad day for that day, and that's about it. It's very rare. Based on my experience, they have 1 or 2 which is highly important on their list, and then the rest are very minor that you can address it with 2, 3, 4 follow-up questions, and they will feel heard already. That is my tips. That's what I typically do during the clinical encounter in my office. I always try to greet them with a positive energy and make sure I have the nice voice dynamic, and then do a small talk and ask them, doing a patient-centered care, is there anything I can do to help you today? That's it. So if you found this video is helpful, please click like and subscribe. I will see you again in the next video real soon.